നമസ്കാരം. ഡയറ്റ് ഇൻസൈറ്റിന്റെ മറ്റൊരു വീഡിയോയിലേക്ക് ഏവർക്കും സ്വാഗതം. ICDS സൂപ്പർവൈസറിന്റെ സൈക്കോളജി വിഭാഗത്തിലെ പേഴ്സണാലിറ്റി ആൻഡ് അബ്നോർമൽ ബിഹേവിയർ എന്ന് പറയുന്ന മൊഡ്യൂളാണ് നമ്മൾ ഡിസ്കസ് ചെയ്തുകൊണ്ടിരിക്കുന്നത്. ആ ഒരു മൊഡ്യൂളിൽ മൂഡ് ഡിസോർഡർ എന്ന് പറയുന്ന ടോപ്പിക്കാണ് നമ്മൾ 2 വീഡിയോസ് ആയിട്ട് ഡിസ്കസ് ചെയ്യുന്നത്. അപ്പോൾ ഇന്നത്തെ വീഡിയോയിൽ മൂഡ് ഡിസോർഡറിന്റെ ഭാഗമായ ബൈപോളർ ഡിസോർഡറിനെ പറ്റിയാണ് നമ്മൾ ഡിസ്കസ് ചെയ്യുന്നത്. അപ്പോൾ നേരത്തെ ഉള്ള മൂഡ് ഡിസോർഡറിന്റെ വീഡിയോ കണ്ടിട്ടില്ലാത്തവർ ആ ഒരു വീഡിയോ കണ്ടതിന് ശേഷം മാത്രം ഈ ഒരു വീഡിയോയിലേക്ക് വരിക. അപ്പോൾ നമുക്ക് നോക്കാം ബൈപോളർ ഡിസോർഡർ എന്താണെന്ന്. Bipolar disorder or manic depressive disorder, which is also referred to as a bipolar affective disorder or manic depression, is a psychiatric diagnosis that describes a category of mood disorder defined by the presence of one or more episodes of abnormality, elevated energy level, cognition and mood with or without one or more depressive episodes. Symptoms of bipolar disorder. Bipolar disorder is a condition in which people experience abnormality, elevated and many places abnormality, depressed states for periods of time in a way that interferes with the functioning. Bipolar disorder is distinguished from major depression by at least one episode of mania. Any given episode is classified as depressive, manic or mixed according to its prominent features. Depressive episodes. A depressive episode has features typically of major depression, including depressed mood and anhedonia, psychomotor retardation, and feelings of pessimism and guilt. Sleeping and eating often increases. Delusion of guilt accompanied by self-loathing are common in psychotic depression, and some patients have hallucination. Signs and symptoms of the depressive phase of bipolar disorder include persistent feelings of sadness, anxiety, guilt, anger, isolation or hopelessness, disturbance in sleep and appetite, fatigue and loss of interest in the usually enjoyable activities, problem in concentration, loneliness, self-loathing, apathy or indifference, loss of interest in sexual activity, shyness or social anxiety, irritability, a chronic pain, lack of motivation and morbid suicidal ideation. In severe case, the individual may become psychotic condition is also known as severe bipolar depression with psychotic features. Manic episode. A manic episode is defined as one or more than 1 week of persistently elevated, expansive or irritable mood plus 3 or more than 3 of the following additional symptoms. That is, inflated self-esteem of grandiosity, decreased need for sleep, a greater talkativeness than usual, persistent elevation of mood, a flight of ideas or rising of thoughts, destructibility, and increased goal-directed activities. People suffering from bipolar disorder commonly experience an increase in energy and decrease the need for sleep. A person's speech may be pursued with the thoughts, experience as racing, attention span is low, and a person in manic state may be easily distracted. They may include in substance abuse, particularly alcohol or other depressants, cocaine or other stimulants, sleeping pills. Their behavior may become aggressive, intolerant or intrusive. People may feel out of control or unstoppable. People may feel they have been chosen and are on special mission or have other grandiose or delusional ideas. Sexual drive may increase. Manic patients may inhospitability, excessively and impulsive, involved in various pleasurable high-risk activities, for example, gambling, dangerous sports, promiscuous sexual activity without insight into possible harm. Symptoms are so severe that they impair functioning. Typically, patients in manic episode are exuberant and flamboyant of or colorful dress. They have an authoritative manner with a rapid, unstoppable flow speech. Hypomanic episode. A hypomanic episode is like extreme, a variant of mania involving a distinct episode that lasts for or more than 4 days and is distinctly different from a patient's usual non-depressed mood. Hypomania is generally a mild to moderate level of mania characterized by optimism, pressure of speech and activity, and decreased need for sleep. Some people have increased creativity while others demonstrate poor judgment and irritability. May people experience hypersexuality. During the hypomanic period, mood brightness, the need for sleep decreases and psychomotor activities accelerated. For some patients, hypomanic periods are adaptive because they produce high energy, creativity, confidence and supernormal social functioning. Next one, mixed episode. A mixed episode lacks depressive and manic or hypomanic features. In at least 1/3 of people with the bipolar disorder, the entire episode is mixed. A common symptoms are excessive mood, crying, racing thoughts, grandiosity, psychomotor restlessness, suicide ideation, delusion, auditory hallucination and confusion. This presentation is called dysphoric mania. Classification of bipolar disorder. In DSM-4-TR and ICD-10, bipolar disorder is conceptualized as spectrum of disorders occurring on a continuum. The DSM-4-TR lists 3 specific subtypes of 4 non-specified. First one, bipolar first disorder. Second one, bipolar second disorder. Third one, cyclothymia. And fourth one, bipolar disorder not or not otherwise specified. Bipolar first disorder. Bipolar first disorder is mainly defined by manic or mixed episodes that at least 7 days or manic symptoms that are so severe that the person needs immediate hospital care. Usually the person is also have depressive episodes typically lasting at least 2 weeks. The symptoms of mania or depression must be a major change from the person in normal behavior. A person with the bipolar disorder experiences episodes of mania and usually major depressive episodes as well. Second one, bipolar second disorder. Bipolar second disorder is defined by a pattern of depressive episodes shifting back and forth with the hypomanic episode, but no full-blown manic or mixed episode. It is no manic or mixed episode, so it is very difficult to diagnose. Next one, cyclothymia. Cyclothymia or psychothymic disorder is a mild form of bipolar disorder. People who have cyclothymia have episode of hypomania that is shift back and forth with mild depression for at least 2 years. Depressed more for the day for more days than not for 1 year, including the presence of 2 or more the following symptoms. First one, poor appetite or overeating. Second one, insomnia or hypersomnia. Third one, low energy or fatigue. Fourth one, poor concentration. Fifth one, feeling of hopelessness. Bipolar disorder not or not otherwise specified. Bipolar disorder not otherwise specified is diagnosed when a person has symptoms of the illness that do not meet a diagnostic criteria for either bipolar first or second. Treatment of bipolar disorder. There are a number of pharmacological and psychotherapeutic techniques used to treat bipolar disorder. Hospitalization may be required, especially with the mechanic episodes present in a bipolar. First, because bipolar disorder is a lifelong and recurrent illness, people with the disorder need a long-term treatment to maintain control of bipolar symptoms. An effective maintenance treatment plan includes medication and psychotherapy for preventing a relapse and reducing symptom severity. Some type of medication generally used to treat bipolar disorder are listed below. First one, mood stabilizing medication. Second one, atypical antipsychotic medication. Third one, antidepressant medication. Fourth one, psychotherapy. That include cognitive behavior therapy or CBT. Next one, family focused therapy, interpersonal and social rhythm therapy. And last one, psychoeducation. ഇന്നത്തെ വീഡിയോയിൽ നമ്മൾ മൂഡ് ഡിസോർഡറിൻ്റെ ബൈപ്പോളർ ഡിസോർഡർ എന്ന് പറയുന്ന ആ ഒരു ഭാഗമാണ് നമ്മൾ ഡിസ്കസ് ചെയ്തത്. ഇത് നോട്ട് ഉൾപ്പെടെയാണ് നമ്മൾ ഇന്നത്തെ വീഡിയോയിൽ തന്നിരിക്കുന്നത്. ഈ നോട്ട് നിങ്ങൾ എഴുതി വെച്ച് തന്നെ പഠിക്കാൻ ശ്രമിക്കുക. മൂഡ് ഡിസോർഡറിൻ്റെ മറ്റൊരു ഭാഗവുമായി അടുത്ത വീഡിയോയിൽ വീണ്ടും കാണാം. ഇതുവരെ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്തിട്ടില്ലാത്തവർ ദയവായി ചാനലൊന്ന് സബ്സ്ക്രൈബ് ചെയ്യുക. അടുത്തുള്ള ബെൽ ബട്ടൺ കൂടി ഒന്ന് പ്രസ് ചെയ്താൽ ഞങ്ങൾ വീഡിയോ അപ്ലോഡ് ചെയ്യുമ്പോൾ തന്നെ നിങ്ങൾക്ക് അതിൻ്റെ നോട്ടിഫിക്കേഷൻ ലഭിക്കുന്നതായിരിക്കും. അപ്പോൾ എല്ലാവർക്കും വിജയാശംസകൾ. എല്ലാവരും ICDS സൂപ്പർവൈസർ എക്സാമിന് വേണ്ടി ഹാർഡ് വർക്ക് ചെയ്യുക, പഠിക്കുക. എല്ലാവർക്കും വിജയം ആശംസിക്കുന്നു. താങ്ക് യു.